you are in charge and you are advocating for that patient, even if they're being a total pain in the rear end.
Don't get me started on that.
Yeah, exactly. Exactly.
You are listening to EMS with your hosts, Erik Axene and Matt Ball.
Well, we got a pretty important topic to discuss today, Matt.
Yep.
There's a lot going on in the world today regarding, it's not new today, it's been going on for as long as we've been pre-hospital paramedics and first responders. We have, unfortunately, seen some folks just do stupid stuff.
Yeah, dropping the ball, not making good clinical decisions, not making good patient advocate decisions, and in turn, some paramedics and EMTs are actually being not just losing their patch, maybe getting terminated, but actually facing criminal charges.
Yep.
One case out of Illinois, there's 2 EMTs facing a first-degree murder charge for the treatment of a patient that they had. So yeah, big issues.
And you know, from just stepping back from the issues just for a little bit, and we talked about this the other day, is our first responders are underpaid and overworked.
Totally.
In certain areas,
Yep.
where you're just go all the time, and you get tired, you get burned out, and it's not just being tired and burned out. There's the moral injury of things where you're dealing with pain and suffering and death all the time. It takes a toll on your brain,
Absolutely.
and so it's a tough place to work. And a lot of these private EMS agencies are really, and other fire departments and whatnot, and there's a lot of volunteer fire departments out there, where there's a lot of underpaid folks out there working their tails off to serve people, and then one thing happens, and then
you're villainized instantly. I mean, it's kind of similar, not to get off track, but the nurses, back when COVID hit, they were the heroes, and now they're, kind of being thrown by the wayside, and, that kind of goes to show that kind of thing can happen. But yeah, ever since 2020 and COVID, I mean, people are just running, our call volumes are way increased. The number of people calling 911 is through the roof. And like you said, especially with private ambulance people making barely minimum wage, little over minimum wage, and they're having to deal with the situations that we deal with, and life-threatening. And then you have the abuse of 911, where you have the high-volume users or frequent flyers, whatever you want to call them, but people that are constantly abusing 911, calling 911. It is very easy to get frustrated. It's very easy to get lose your patience with some of these people. I mean, we're all human.
And the reality is, too, a lot of our colleagues in the fire department have gone into the fire department to fight fires.
That's true, too. That is very true.
70% of all calls, it's actually 68%.
Yeah, nationally,
the vast majority of the calls are medical calls. 2% for fire suppression nationally, that's the average. And depending upon the age of your community and infrastructure, it may be higher or lower, but that's another thing, too, that, a lot of the paramedics, rightly or wrongly, that I've worked with, have been on calls, and it's like, man, just get me out of the ER. I want to go back to the fire.
Dose of diesel. Let's just go.
But we're and this is actually really what really gets me fired up, and we're going to talk about it. But is to see the lack of care sometimes when we are in a patient's home, and the care that I read about in the documentation. So subpar that this medical education stuff, to me, that's why I'm so passionate about it, and I want to equip and help people, help other people, and you and I are still connected to the first responder world. Obviously, you're full time in it, and then as a medical director too on ride outs and in the ER. But that I think. I'd like to circle around to that, eventually get to education. But right now, that we talked a little bit about the Springfield, Illinois issue, where you see some legal consequences, huge implications. You've got the Aurora, that was a few years ago, but the Aurora incident with that young man in Colorado, given ketamine, and then unfortunately passed away. We're not going to get into details on it here today, but I think understanding, though, this is the environment that we're working in, and we have a capability to do things. Man, an accountant can't put their patients to sleep. You're not going to call up your local accountant or whatever, and when you have an emergency or you feel like your life is in danger.
Yeah.
We are responding to some pretty stressful events, right?
Yes, most definitely.
And then when your job calls on you to basically take somebody's life and put it in your hands, which is what's happening when you give somebody Versed or ketamine or whatever induction medication, or you have to intubate somebody.
Yep. Paralytics.
Right.
Yeah.
You're paralyzing your patient. Basically, potentially what's happening is you have a patient that's a harm to themselves or other people, and you're able to take them down with medication.
Yeah, you're taking a breathing patient and you are injecting a medication into them so that they stop breathing. Now, ultimately, you're doing that to try to control the airway because you fear that they're not going to have that ability. Yep. But that is a massive responsibility that I did not have when I started in EMS 18 years ago or with the fire department. We did not have that ability then. There's still a lot of medical directors, doctors, anesthesiologists that think absolutely not. Paramedics, first responders should not have the ability to do these things. But the reality is that we have it, and it's out there. And so, you talked about years ago, a lot of people get in the fire service because they want to get in the fire service because they want to fight fire. And I don't think they've realized my protocol treatment book has tripled in size since I started. And
sorry.
No, it's fine because the science and the data shows that we can have a greater impact. That timing that we get there is so crucial before we can get them to you in the ER that we can really have a massive impact on whether somebody lives or dies in some situations if we know what we're doing. But it's become much, much more complicated.
It has.
And when you look at, you went to school for how many years to be a medical doctor?
A lot.
Like 12 total with
undergrad?
Undergrad, everything.
Yeah, it's over, I guess, 11 years of school. Is that right? Yeah,
so 11 years of school to do the things that you do in the ER. My paramedic class was 6 months long. 6 months long. And in a life-threatening situation, you know this as well as I do, there's not much more that you do in the ER that I won't do in the back of that box.
Yep.
Intubating, crikes, IVs, all that kind of stuff. So I don't know if a lot of people understand what goes on in the back of the ambulance and what we are responsible for.
Yep.
And before they get into the job. And so one of the things, again, we talked about the incident in Colorado, the incident in Illinois. There was also an incident in Dallas where, and all these incidents involved PD being on scene first because you had either a violent or combative patient, something like that. And then EMS comes in behind to kind of take care of the patient. Sure. And there's a lot of things just within that relationship that we could talk about. And I think the biggest one is if you're a first responder, if you're a paramedic, if you're an EMT, if you take nothing else away from this podcast, in my opinion, remember that you are the patient's advocate on that scene. Your number one responsibility is to that patient, regardless of who else is on that scene, period. Medically, you are in charge and you are advocating for that patient. Even if they're being a total pain in the rear end, they're being abusive to you verbally, whatever, you have to keep in your mind that you're still that patient's advocate. Yep. And I think if you do that, that'll be a good compass for you to stay with, and you'll probably stay out of trouble. Yeah. It's when you lose that compass or you lose that way and you start listening to, and I totally understand police officers, they just got into a fist fight with a guy or a vehicle pursuit with somebody or maybe even a shootout or something.
Sure.
Their adrenaline's pumping. They're amped up. You've got a whole group of cops sitting there. I've been on these scenes where cops got involved in a fight and they're adrenaline dumping. And then you show up and they're in just rage mode, right? Yeah. And now you're dealing with the person that just caused them all these problems. Which I understand, they're going to be very hostile, possibly and aggressive towards that person. And like we've talked about, I think it's important to remember that when you're an EMS, whether you're a private EMS or you work with a fire department, you are not employed by the police department.
Yeah.
And you do not have to do what the police department tells you to do medically on that patient. You are the medical expert. You make the medical decisions for that patient, not the police officer. I'm not going to go into a SWAT situation and tell a SWAT officer how to handle a barricaded shooter. I'm not going to do that because that's not my expertise.
Right.
So in my opinion, he has no business coming up to me telling me how to treat a gunshot victim. That's my level of expertise. And so I think if you keep those two things in perspective as a first responder, that'd be good.
I think that's what happened in Aurora. I mean, from
Alleged,
what I've
yeah,
read,
right.
There was a culture there where the law enforcement was able to use the capabilities of those paramedics and EMTs to accomplish some of their goals from a law enforcement perspective,
Sure.
which was inappropriate.
Yeah.
And so cultures can be different in different municipalities and areas. Too.
Relationships between fire departments and
Yeah.
police departments can be very different. Luckily, where I work, we work very well with our police officers. They're great to us. We're great to them. But I've been on scenes where I remember one scene in particular. Two 15-year-old males were fighting middle of the night. They were fighting obviously on something, very combative. We got there, 4 police officers on each one of these guys. They're combative. And the cops were like, can you give them something? Well, medically, it's my responsibility to make sure that they can take a sedative, right? Now, our protocols are, it's always preferred that you chemically sedate somebody as opposed to physically sedating them. Right. It's safer for the patient, it's safer for you, it's safer for the officers. However,
to give them the meds, you're going to have to physically restrain them.
Well, that, and you need to make sure that if somebody's on the ground face down and they're breathing 2 times a minute, I'm not going to push a benzo on that patient. No. And you need to know those kind of things and so don't get sucked into
Don't get me started on that.
Yeah, exactly. Exactly. It can be very frustrating, but it's hard.
So I'd like to unpack a little bit of what you said, and I think it's important. I'm not sure, there's so many different perspectives and opinions. I was speaking with a physician friend of mine who had no idea there was a difference between an EMT and a paramedic.
It doesn't surprise me.
And but I think what I'd like to just point out real quick, and if you don't realize this, I know you do, we've talked about it, but part of my job as a chief medical officer for a healthcare consulting firm is to work with hospital groups, government agencies, and help improve healthcare from from an implementation or an operational standpoint, where the government's perspective is changing. We are starting to see now the government recognizing the value of what the pre-hospital environment and paramedics offer to the whole healthcare continuum. And now Medicare is starting to throw dollars at it.
Yep.
The responsibility and the accountability is going to go up for anything we do medically speaking in that pre-hospital environment.
A lot more.
Whereas maybe yesterday you could get away with a lot of things.
Yeah.
You're not going to get away with it down the road.
Nope.
And I want to say that as a compliment to us in the pre-hospital environment, how important it is to realize the responsibility that we have in delivering health care to these hurting people before they get to the hospital. The healthcare continuum doesn't start in the ER bay. It starts in their home. Actually, even before that, I guess the preventative medicine and then them recognizing the need for a call. But, just a couple quick stories. I mean, it's not just paramedics either. I mean, the law enforcement folks are usually the first there. And
depending on the scene.
Depending on the scene. But I know I'm thinking of a case now where we actually talked about this in one of our trauma lectures. But the administration of a tourniquet saved that patient's life.
Yep.
And that was done by law enforcement.
Yep, absolutely.
Paramedics obviously arrived, take the patient to the ER. We hook them up with a vascular surgeon. We get them fixed up. They get discharged home. That was that patient's healthcare journey. But it wouldn't have started had that law enforcement
wouldn't have made it that
there.
far.
He knew how to use a tourniquet, and he put it on quick. And saved that guy's life. The same thing could be true for the disease recognition with a paramedic who understands, wow, I was here for a behavioral emergency, but I'm recognizing the fact that this patient is in a life-threatening metabolic disorder. We need to get him out of here. we need to get him to the hospital. If we don't do this soon, he could die.
Yep.
And I think that's what gets me so fired up in these cases is the lack of medical education that I'm seeing. And listen, like you said, the pay is low, they're overworked, they're burned out.
Yep.
The last thing anybody wants to hear is that you don't know enough.
Yeah.
But what we do at ACE and making difficult, complicated concepts easy to understand, you don't have to be a physician to recognize a respiratory emergency.
Right.
In the Springfield call, for example, we could hear the breathing rate of that man. We could, and we knew he was an alcoholic.
Yeah.
The possibility of alcoholic ketoacidosis. We don't need to talk about all the stuff there, but the point is a life-threatening disease, or delirium tremens. The life-threatening consequences of alcohol withdrawal. My point is, with medical education, we really have to be able to recognize the responsibility that we have to identify disease processes.
Yep.
If we're going to be held accountable and we're really going to be part of this whole medical continuum, then we better be prepared to do it.
I think one of the takeaways too with Springfield, and there's just some things that you should, in my opinion, this is Matt Ball's opinion, you should never do. And you should never transport a patient face down. I mean, that in our protocols, it is specifically written into our protocols. You never transport a patient face down. You just don't do that. Now, what people do nationally, what's in their protocols, I don't know, but I cannot imagine a situation where I would transport a patient face down. I just wouldn't do it. You can have them face up and restrained. You can, you can chemically restrain them. There's lots of different things, but when you have a patient face down, you have no access to their airway. You cannot assess their breathing rate. That's just a bad idea in general, regardless of your educational standpoint. If you're an EMT, if you're a paramedic, regardless of what you know or don't know, you should never do that.
Right.
Regardless. And another thing, I think, when you look at the global picture, though, when you think about, we're talking about 3 cases that have come out, and this is over the span of the last couple years. It's not just last year. And when you think about the millions of EMS calls that have been run just in the United States over the last 5 years. And we're talking about 3 incidents.
Yeah.
That's really good numbers. For the most part, it's kind of like,
True, good point.
The police shootings and things of that nature. For the most part, the majority of EMS runs, people are doing what they're supposed to do, and they're doing right by their patients on the vast majority of those calls. One thing, too, to note on all of these calls, that we see is the presence of, how do we know about these calls? Body-worn cameras from the police officers. Every one of these incidents has body-worn cameras.
Being watched.
And that's a good thing. I mean, I
Accountability.
think absolutely. Police officers agree that's a good thing. From an EMS standpoint, we don't wear body cameras, but when I'm teaching at fire departments, I tell people, the second you pull out of that fire station, you are on camera. Your driving and how you drive is on camera. Approaching the house with Ring cameras and security cameras, you're on camera. People on scene with cell phones, whether you're on a car wreck or I've been in a house treating patients with the parents sitting there videotaping me doing it.
Oh, yeah.
Now, obviously I knew that, but if you just have in your mind, and you should absolutely have this in your mind, if you are on scene with the police department, you are on video camera. Period. Whether it's a dash cam or a body-worn camera, you are on video and you're being video and audio recorded.
And you're probably aware of this, but as a medical director for a large private EMS company, I'm not going to name any names,
right?
But these are being discussed as putting cameras in the ambulance.
We have cameras in our. We've heard about cameras being put in the back. So treatment-wise, and I look at that as that's protecting me so that my patient can't come back and go, he did this or he did that. I've got video proof that I didn't do any of that or whatever. But that's one thing that I think is important for responders to keep in mind is that in this day and age, you're being videotaped. And every one of these incidents, they could dispute facts, but they can't dispute it if it's on video. It's really hard to dispute if you walked in and gave a patient that was breathing 3 times a minute, and you walked up and gave him an IM injection of a benzo.
And didn't monitor him.
And didn't even check his vital signs, and it's all on video. That's kind of hard to justify that, So one thing that we really need to think about because from a fire department perspective, we're behind the curve. PD's been doing it for years.
Yeah.
And we haven't been, so we're kind of catching up to that mindset.
There's dosing issues. There's administration issues.
Yep.
There's monitoring issues.
Goes back to education.
Side effect complication issues.
Yep.
But either way, I think that the medical education that has to happen on the front end before these things are administered, these medications, before we take a patient's airway.
Yeah.
I really believe in. We are smart. We are smart individuals out there that have tremendous potential and ability to make their communities more safe.
Yep.
And I think bringing healthcare to folks, making them more whole.
Absolutely.
However you want to word it, that's a huge compliment, and people are starting to recognize our value more.
Yeah. Yep.
But with that's going to come more responsibility.
Yep. More accountability.
And more accountability.
Yep.
That's right. And I want to be on the front of the curve. And again, that's why we love it. Medical education.
Yeah. Yeah, it's not, I think for the most part, it's not difficult to do the right thing by your patient. Mm-hmm. And when you go on these calls, I get that guys want to fight fire and do that kind of stuff, but my gosh, here's my argument to that. Well, I want to be a fireman. Okay, well, what if I want to be a paramedic? Is it acceptable that I'm a firefighter paramedic? Is it acceptable that I go to that structure fire and I get off on the engine and I pull that line to the front door and I open that front door and it's ripping inside that house? Is it acceptable for me to put that hose down and say, nah, I'm not comfortable doing this. I'm not going to do that? I would get destroyed at the fire station, and rightfully so. Mm-hmm. I would get destroyed at the firehouse for doing that. I would be called into the chief's office for cowardice, I would assume. Mm-hmm. But yet, how many times in the back of the ambulance do people get scared? They don't know what to do with the patient. Let's just go, or they're doing these treatments and things without properly assessing patients, and that's not acceptable. Sure. In my mind, it's just not as acceptable as not going into a burning building.
And I think that's why you are such a trusted profession in our society, is that you are the guy, you're the girl who is going to run into that burning building and not think about their safety. They're going to think about your safety first, the community safety first. And I think that I love to hear you say that. And it's a little different in that you are the best person suited to do that. Sometimes you're in a medical situation where you recognize the fact that, wow, there's nothing I can do here. This guy's spleen is ripped in half probably.
Got to get him to where they need, yeah.
But now it becomes the fact that you recognize the disease.
Absolutely.
And your life-saving care is the fact that you got the heck out of there and delivered them quickly. Or knew to call the helicopter or whatever. But disease recognition should be something that we are experts at, because there's nobody else there.
Yep.
The law enforcement guys aren't held accountable to the same standards.
They're not medical professionals.
No.
Again, we shouldn't be held accountable for policing issues and vice versa.
Those law enforcement officers in Springfield, Illinois, were looking at that guy, listening to him breathe fast, asking if he wanted some water. And I thought, frankly, they were very friendly.
They seemed,
and
from what we saw in the video, they seemed like they were very cordial, very friendly.
And for the record, too, and I'm not talking specifically about Springfield, but even after the call was over and the body cams were still playing, they were joking around a little bit.
Yeah.
Even, in the ER, sometimes we'll say some things in the doc area or be in the nursing area or whatever, and we'll talk about a patient, and that's kind of a way that we deal with some of the stressful situations we're in. Yeah. And we'll say some things that we wouldn't want our patients to hear, but it's almost just a way. It's not being insulting. It's a way we cope.
Dealing with it, the dark humor.
I just lost a patient.
Yeah.
And so being able to use some humor with another patient helps us to stay on track emotionally as we move forward, because the patients are going to keep coming in. You're going to keep getting calls.
You can't tap out.
Yeah. So there is something that the community may not understand, because nobody can really explain the trauma we feel when we are on scene explaining to mom and dad, their child died. Mm-hmm.
It's the DeMar Hamlin situation in the NFL. Yeah. When he went into cardiac arrest, and the announcers aggressive CPR, and the people in the stands and the other players said that was so traumatic that they couldn't continue. And I completely agree with their decision to stop the game. That was the right thing to do. I can't do that. Yeah. I can't do that. I can't run on a dead kid and do CPR on a dead kid, or tell a mom that her kid just died. And then, I mean, I guess technically, if I really was having that rough of a time with it, I've got good officers, thankfully, in the department that I work for. And I've actually had on tough calls, I've had, when we got back to the station, a captain come up to me and say, if anybody needs to go home, go home. Like, if you need to take the rest, and that is, if you have a good department and a good support system in your department, sometimes that is an option. But most of the time, for a lot of people, it's not, especially in private ambulances.
Hey, you're back in service. Get ready to go.
Yeah, next
Tones
we got
go
calls
off.
pending. Yeah, let's go. Suck it up and deal with it.
That's
yeah,
tough.
it's very tough. Like I say, I think people think that, we're not superhuman.
You're a robot.
Yeah, we're not robots. We're not superhuman. We're just like any of those NFL players or any of those people in the stands that saw that. We're no different. We're flesh and bone, just like anybody else.
Yeah.
And like you said, the dark humor is one way that, unfortunately, we kind of deal with it. But
Well, that's the reality of the type of job we have. You mentioned the trauma of being in a situation that's just emotionally taxing. I mean, really just, we even talked about some stories today that brought tears to our eyes. That we've had to do and walk through. There's a trauma there that occurs, and similar to what I've heard some of the military folks in my own family describe. These are things that most people don't experience, and it's hard to explain it to them. But to talk about the things we're talking about can be therapeutic. Just talking about it and understanding where we come from. These lawmakers that are throwing down these decisions and doctors who are saying you shouldn't be able to do this, or just community members saying, hey, you idiot. It's a complicated issue. Nobody goes to work wanting to hurt people. Well, that's probably not true. There's some idiot doctors out there that actually
there's some idiot firefighters, and there's idiot everything's out there.
But like you said earlier, the vast majority, we deal with a profession of heroes. We go into that burning building with no thought of ourselves, thinking about saving other people.
Right.
When we have a sick patient that calls 911, we think about getting them the best care that we can possibly deliver.
Yep.
Are we perfect? No.
Nope.
We all make mistakes, but we all have a heart to make people more healthy and to save lives.
Yeah.
And that's something we can never take away from our first responder community.
Nope. I think that as a first responder, we need to keep in mind that we are not above the law, and we can be held legally and criminally liable if we do, the wrong thing to our patient. And these are pretty negligent wrongs that these cases that we've talked about. I mean, I don't think any of these cases have gone all the way through to court, but as far as the information that we had, like, there was mistakes made.
Sure.
There was definitely mistakes made, and things could have been done better. And so I think as first responders, we really need to pay attention to what we're doing.
Yep.
And, again, do the best. You're the patient advocate. Do what's best for your patient every time. And most of the time, you're not going to have a problem. You're going to be in the right, and you're going to be okay.
Yeah.
So.
I think that's a good way, I think, to end this short podcast is a conversation about the heroes, but also the gravity of the decisions we make.
Yep.
And the responsibility that we carry.
Yep.
It is complicated. And I like to think that with medical education, we can try to help make jobs easier for people, give people clarity. And I wish I could have just spent 30 minutes with those Springfield paramedics. But I don't know what the rest of their day looked like. I don't know what their family life is like. Life is complicated. But from a medical perspective, in delivering care, there were some basic things that weren't done that we have to do them. I don't care. My quick story. I had a tough day. It doesn't mean that I can talk to my wife disrespectfully.
Exactly.
You have a tough day, and we just compartmentalize our lives, and I know it sucks, but we got to move on. We just got to call. Or there's another patient waiting in the ER for me. Oh, I got another trauma coming in. So we have a tough job.
Yeah, and some people have it tougher than we do. But it's important topics.
And from an ER doctor perspective, it's an honor to be part of that first responder community. Absolutely love what you do and what our viewers do. This has been a great podcast. Thank you, Matt, for taking time to talk about all this.
Thank you. It's a good talk.
Yeah, be safe out there.